Welcome to Behringer Talks, the show where we answer questions that you, our customer, have using our 50 years of industry knowledge and expertise. Today's question: does bariatric surgery help decrease diastolic heart failure? Diastolic heart failure occurs when the left ventricle becomes stiffer than average and cannot appropriately fill with blood during the diastolic or filling phase. So, the left ventricle is one of the heart's four chambers responsible for pumping oxygen rich blood out to the body. Therefore, the amount of blood pumped out to the body is less than normal. As our bodies age, the heart and blood vessels become less elastic, thus making this condition more prevalent in the older population demographic. High blood pressure, diabetes, coronary artery disease, and obesity or inactivity can cause diastolic heart failure. On September 16th of 2021, General Surgery News released an article headlined, "Bariatric Surgery Decreases Hospital Admissions for Diastolic Heart Failure," which summarizes new research presented at the 2021 annual meeting of the American Society for Metabolic and Bariatric Surgery, or ASMBS, abstract number A008. Quote, "The researchers conducted a retrospective analysis of the National Inpatient Sample Database from 2010 to 2015, dividing patients into those with and without a history of bariatric surgery. The multivariate logistic regression analysis demonstrated that patients who did not undergo bariatric surgery were at a significantly higher risk for being admitted for acute and chronic diastolic heart failure. Patients in the control group with no history of hypertension were almost 5 times more likely to be admitted for acute diastolic heart failure," Dr. Funes said. Furthermore, the odds of prevalence for chronic diastolic heart failure were 2 times higher in the control group when compared to their counterparts in the surgical group. The multivariate logistic regression analysis demonstrated that the odds of hospitalization for diastolic heart failure, specifically for patients with a history of coronary artery disease, was almost 3 times higher in the control group when compared to the surgical group." End quote. Behringer's Visage 3D device is the first FDA-approved and market-leading sleeve calibration system in the world intended for bariatric procedures. Released in 2013, we are proud to always be at the forefront of developing bariatric patient care, with options now including robotic-assisted surgeries and gastric bypass. Supporting the benefits of bariatric surgery is becoming easier every day.